of the virus outside Africa. The declaration will allow the government more funding and resources to fight the spread of the virus. Well, joining me now to discuss this is Dr. Adam Brown, who is an emergency physician. Dr. Brown, thank you very much for joining me. How has monkeypox gone from being a rare disease in the US to a national health emergency in just a matter of weeks?
Well, I think, frankly, part of the reason for that is there just has not been the coordinated response and the resources that we have needed to contain this virus. If you were to look back when the virus was first found in the United States at the end of May, and then moving into June, we didn't have adequate vaccines, we didn't have adequate communication, tools and resources to contain the virus. Now we do have the vaccine, but the supply of those vaccines is quite low. So it's not surprising that we would see this virus spread in a somewhat unmitigated fashion.
So is this also a case that lessons from the pandemic, the COVID-19 pandemic, just haven't been learned?
I think that's an excellent point. In my prior role for 2 years, I led the national COVID response for one of the nation's largest leading medical groups. And I saw the importance that the public health emergency provided in coordinating resources, coordinating communication across states, making sure that we had enough vaccines and treatments and testing. And that simply isn't here right now. You know, we only have just a little over 1 million vaccines allocated throughout the states. And here in DC, there's only 15,000 vaccines in a city of 750,000. So that's just not enough to contain the virus. And so we have 50 different states with 50 different solutions, plus DC, trying to come up with the best way to protect its citizens and how to prevent the spread of the virus. So fortunately, with the public health emergency, I'm hopeful that we'll start to have a more coordinated response and better resourcing.
So how worried should people be right now about contracting this disease?
Well, right now, the number of cases are relatively low. There's a little over 6,000 cases here in the United States, and it's cloistered more so in some cities with certain communities. That said, this is a skin-to-skin contact disease. This is also a disease that has some respiratory spread component to it and can be spread through some linens. And so anyone can get it. You know, I like to tell people viruses do not discriminate. Humans discriminate. And so we need to stay vigilant and watch for signs and symptoms and also watch for the cases within our communities. Here in DC, it's certainly here. We have one of the largest number of people with the virus per capita in the country. And so I'm making sure that all of my friends and colleagues know what are the signs and symptoms to watch for, because it's certainly something that people can get.
And on that note, could you tell us what are the symptoms? What is so bad about monkeypox?
Sure. So most people will have a rash associated with the monkeypox. Now, some of the rashes can be small, like a pimple or a blister on the finger. Sometimes it can be all over the body. And in some patients, about 60% or so, people will start to have fever and flu-like symptoms, body aches. But what's been interesting about this strain of monkeypox is that not everyone has followed the exact same symptom pattern, with having flu symptoms first and then a rash and then painful rashing. Some patients just have a rash. Now, those rashes last anywhere from 2 to 4 weeks. So it's really important for people to be on the lookout for rashes that may be odd, especially if they have fevers and body aches, or if they know they've been in contact with someone who has had monkeypox. If that's the case, they should seek care from their primary clinician.
Dr. Adam Brown, thank you very much indeed for joining me.
Thank you for having me.